Peripheral neuropathy is fairly common in a diabetic and it is customary to brand it as diabetic peripheral neuropathy. But remember, a peripheral neuropathy of any other reason can occur in a diabetic patient as well. So how do you distinguish a peripheral neuropathy in a diabetic and raise the suspicion that it is not a diabetic neuropathy? Here are some points. Whenever the peripheral neuropathy is rapid onset and rapidly progressive, it is unlikely to be diabetic neuropathy. When proximal muscle involvement is there early, it is unlikely to be a diabetic peripheral neuropathy. When there is marked asymmetry in the peripheral neuropathy, it is unlikely to be a diabetic peripheral neuropathy. When there are prominent autonomic features early in the onset, it is unlikely to be diabetic peripheral neuropathy. When there are systemic symptoms of weight loss and fever, it is unlikely to be diabetic peripheral neuropathy. When the peripheral neuropathy starts in the upper limb and then comes to the lower limb, it is unlikely to be a diabetic peripheral neuropathy. When there is waxing and waning in symptoms, it is unlikely to be diabetic peripheral neuropathy. When motor symptoms predominate, it is unlikely to be diabetic peripheral neuropathy. Especially the relapsing remitting pattern or the NCS shows a non-length dependent pattern or demyelinating pattern. It is less likely to be diabetic peripheral neuropathy. It's always good to remember CIDPs occur much more frequently in a diabetic and it's a treatable option in peripheral neuropathies in diabetics.